Eccentric calf stretching refers to a specific type of stretch or exercise that emphasizes lengthening the calf muscles, gastrocnemius and soleus, while they are under tension. This type of stretching is particularly useful for improving flexibility, strength, and injury prevention, especially for conditions like Achilles tendonitis or plantar fasciitis. Why the calf muscles become tight? Tightness in the gastrocnemius aponeurosis can occur due to several factors related to the structure, function, and use of the gastrocnemius muscle, the large calf muscle, and its associated aponeurosis, a broad, flat tendon-like tissue. The gastrocnemius aponeurosis helps connect the gastrocnemius muscle to the Achilles tendon and the heel bone, allowing for powerful movements like plantar flexion, pointing the toes downward. Tightness in this area can arise due to 1. Overuse or repetitive strain. Repetitive activities like running, jumping, or walking on inclines can cause microtrauma to the gastrocnemius muscle and aponeurosis, leading to tightness and stiffness. The muscle can shorten over time, particularly when overused without proper stretching or recovery. 2. Poor stretching routines. A lack of proper stretching of the gastrocnemius muscle can lead to muscle shortening and tightening of the aponeurosis. When the muscle and tendon complex are not regularly stretched, they lose elasticity and become stiff. 3. Age-related changes. As we age, tendons and aponeuroses lose some of their natural elasticity and flexibility, making them more prone to becoming tight or stiff. This can also increase the risk of injury or strain. 4. Inactivity or prolonged sitting. Prolonged inactivity, such as sitting for extended periods, can cause muscle tightness, including the gastrocnemius and its aponeurosis. When the muscle remains in a shortened position for too long, it may stiffen. 5. Muscle imbalance. Tightness in the gastrocnemius aponeurosis may result from compensatory muscle imbalances or improper biomechanics in the lower limbs. For example, weak or imbalanced muscles in the feet, legs, or hips may place extra strain on the gastrocnemius, leading to tightness. 6. Footwear and high heels. Wearing high heels or poorly fitted shoes can contribute to the tightening of the gastrocnemius and its aponeurosis, as these shoes force the ankle into plantar flexion, downward pointing of the foot, keeping the gastrocnemius in a shortened position. Seven. Injury or scar tissue. Trauma or injury to the calf muscle, Achilles tendon, or surrounding areas can lead to the formation of scar tissue, causing tightness and restricting movement in the aponeurosis. Orthopedic surgeons uses the silver skull test is to assess whether tightness or limited dorsiflexion of the ankle is due to the gastrocnemius muscle or the Achilles tendon, more specifically the soleus muscle or Achilles contracture. It helps differentiate between gastrocnemius tightness and Achilles tendon or soleus tightness by testing ankle flexibility with the knee in different positions. This is how the silver-skilled test is performed. Step 1. The patient lies on their back, supine, or sits with the leg extended. Step 2. With the knee extended, the examiner passively dorsiflexes, pulls up the foot while keeping the patient's knee fully extended, straight. The degree of ankle dorsiflexion, how much the foot can bend upward, is observed. The knee is kept flexed, and the examiner passively dorsiflexes the foot again, but this time with the knee flexed, bent. The degree of dorsiflexion is observed again. Interpretation of results. If dorsiflexion improves when the knee is bent, the tightness is primarily in the gastrocnemius muscle. If dorsiflexion remains limited with both the knee extended and flexed, suggests that the tightness is likely due to the Achilles tendon or the soleus muscle. Addressing gastrocnemius aponeurosis or Achilles tendon tightness usually involves stretching, physical therapy, and sometimes modifying activity patterns to improve flexibility and muscle balance. How should I stretch my calf? For personalized guidance on calf stretching, you should consult an orthopedic doctor or sports medicine physician can guide you on how to stretch safely and prevent further damage. In fact, it is quite important to understand if you should address a tightness locates to the gastrocnemius or to the Achilles tendon. Gastrocnemius stretch. Find a step. Stand on the edge of a step or elevated surface with your heels hanging off. Keep your knees straight. Slowly lower your heels below the step, feeling a stretch in the calf. Keep the position for 5 seconds. Hold and repeat. Hold the stretch for 5 seconds, then return to the starting position. Repeat for 15 times, at least 3 times a day. Achilles stretch. Find a step. Stand on the edge of a step or elevated surface with your heels hanging off. Keep your knees slightly bent. Slowly lower your heels below the step, feeling a stretch in the calf. Hold and repeat. Hold the stretch for 5 seconds. Return to the starting position. Repeat for 15 times, at least 3 times a day. Tips for calf stretching. Avoid bouncing. Perform each stretch in a smooth, steady manner. Focus on proper alignment. Keep the spine and the hips as straight as you can. Benefits. Injury prevention. Helps to strengthen the Achilles tendon and calf muscles, which can prevent injuries. Improves flexibility. Lengthening the muscle under control increases muscle flexibility. Rehabilitation. Often used in rehab for Achilles tendonitis and other calf-related injuries. If you're recovering from an injury, make sure to consult a professional before adding this to your routine. Thanks for watching and sharing.